There is PowerPoint.
I don't know, on the hallways or even a carrier, one of the patients or even ourselves.
Yeah, the guilty party here, the most common person that spreads infections from one person to another is the healthcare staff. Okay, we are the ones that cause the infection from going from one person to the next, because we are the ones that go visit one resident, one patient, and then go into the next one and so on. And if we fail to take our precautionary measures, then we pick something up. Now, how do you know you pick something up from another resident? But that's the thing, you don't know. Okay, so many times we deal with residents that are contaminated or infected with a bacteria, with a virus, but we don't know. Okay, or we ourselves may be contaminated or infected with a virus or a bacteria, and we don't know. So it's important that we always take these precautions. We call them standard precautions. So standard precautions are those that you take with every single resident, all right? Regardless if they're infected or not, we treat every resident as possibly contagious or infected. So it's important that you remember that and keep that in mind, because the last thing you want to do is contract something from someone, right, and spread it to your family or to another patient or resident. All right, so again, understand what infection prevention is, okay? Methods, sets of methods that we practice in facilities. It's not just one thing, but it's multiple things that we need to always keep in mind and keep on practicing, right? So these microorganisms, they're not all bad, right? We have bacteria in our skin, right? In our mouth, for sure. We have a lot of bacteria inside our gut. We always have bacteria. So somehow our bodies are able to balance, right, between the good organisms and then the bad organisms. The bad organisms are called pathogens, right? A pathogen is a bacteria that is able to cause infection. So if you get sick at one point, if you know someone that contracted the COVID-19 virus, then that person contracted the pathogen, COVID-19, and that COVID-19 was able to cause a systemic reaction in that person. Now, there's a lot of people that contracted the virus, that had contact, but never developed any symptoms or very minor symptoms, right? Now, those that got sick and perhaps even passed away because of the infection, right? They had a very serious systemic reaction. So not all organisms are bad, okay? Only those we call pathogens. Now, some pathogens cause a local infection. You might get a cut, an abrasion, and you know it gets a little red, and it might even put out some a little bit of drainage, okay? And maybe in a couple of days it goes away, right? So that's considered a localized infection, or even your throat infection, or your tonsils get sick in flu season, or you get all these runny nose, and that's a localized infection. Now, once you develop a fever, chills, cold sweats and all that kind of stuff, then you've developed a systemic reaction, okay? So when residents and patients contract something in the facility, right, that did not have before they came in, then we call those healthcare associated infections, okay? So it's important to remember that. Now, healthcare associated infections are not covered by the insurances, all right? So that's why it's really important that you, as a nurse aide, healthcare provider, keep in mind all these practices that we do. Because if you or your loved one goes to a hospital, maybe for a minor procedure, and then you end up with a serious infection that you did not have before, that would be considered a healthcare associated infection. And who caused it? We did. We are the guilty ones that are spreading infections all the time. Why? Simply because we're not following the practices that we're told to do, okay? Like washing your hands, like wearing gloves and so on. So it's really important that we keep these measures always, okay? So now once you understand, okay, well, let me back up. Who can tell me how COVID-19 is spread? What have you heard?
Falta de higiene, que no se lavaban las manos.
Que no se lavan las manos. So does that mean by contact? Like, if I touch someone with COVID, I'm gonna pass
Yes.
this one? Así se pasa? Who else? Give me another one, another answer.
That it spreads through droplets.
Droplet? Droplet means like saliva, coughing, sneezing, talking, right? Okay. What other way did you hear that the virus is spread? Anybody else? Who else is here?
Pues es,
También por el
viral.
aire, like when we cough or sneeze.
Coughing or sneezing. Okay, so somebody said contact, somebody said droplet, right? There was also, some people were also saying that they were, it was being spread by airborne. Okay, so we're going to talk about those three different ways that viruses, bacteria can be spread from one person to another. Okay, and but first we have to understand how they travel. Okay, so number one, if we take the COVID-19 example, okay, we're going to talk about something called the chain of infection. Okay, the chain of infection. What is a causative agent? Is it a virus? Is it a bacteria? A protozoa? Right? A fungus? What is a causative agent? In this case, we have COVID-19. That's what they call the coronavirus. And then the reservoir. Who is the reservoir? In this case, they said it originated possibly from some animal in China, right? And it was passed on, right? It had a spillover. It passed on to the humans. And from humans, it went from human to human, all right? So the reservoir, or somewhere where it lives, in this case, are humans, okay? So humans are the reservoirs. What is a bacteria or an organism need, right, to survive and multiply? Well, in this case, it needs moisture, which of course we have moisture. It needs nutrients, right, to eat just like we do, okay? So these living organisms are just like humans, right? Except they're very small and we can't see them, but they're able to cause infection, okay? They disrupt the normal functions of the body. So we serve as perfect reservoirs, okay? So in our bodies, we have organs, we have spaces, it's empty spaces where bacteria like to live, okay? The most common ones are respiratory, right? Respiratory infections, and of course, bladder infections in older adults. So these are places that reservoirs, right? What other items or objects or animals can also serve as reservoirs? Your desk can serve as a reservoir, okay? Your phone, etc. Anywhere there's moisture, okay, it can be a reservoir. Some bacteria can even live on a dry surface without any moisture. So keep that in mind. So that's why we have to practice very good infection control practices, especially right now. So we are the reservoirs in this case. How does the bacteria or virus make it out of the body, right? In this case, we need to have a portal of exit, and we have multiple portal of exits, right? We have our eyes, you shed tears, we touch your faces, we have your nose, your mouth, right? Your genital areas are also considered portals of exit. And also open wounds. If you have an open wound that drains, right, that's considered a portal of exit. So we have to understand this bacteria is, once it goes into a reservoir, in this case a human, how does it make it out, okay? Well, it's gonna make it out through a portal of exit, okay? Right, very good. So we understand that it's gonna come out, right, through one of our body orifices, and then it's gonna go into somebody else through another orifice, okay? In this case, it's a droplet. They say it's a droplet infection, okay? So if I talk and I'm close to someone, I can spread it to that person. If I cough and sneeze, of course. Now, if I cough and sneeze, I'm not gonna do it on someone directly. I may cough and sneeze and maybe spread it on the surfaces that are near to me. And then somebody comes along and touches that hard surface and has contact, right? And then it touches the face and so on. So the little spread of infection continues. So it made it out of my body through my nose or my mouth in this case, okay? And then it was mode of transmission is how it travels. So we know that the coronavirus travels in droplets. At least that's what they're saying right now, okay? Now let me tell you something right now. Droplets are supposed to be large molecules, okay? Large molecules that are unable to pass through a regular mask. Like if you wear a cloth mask, they're not supposed to go beyond that. They're supposed to get trapped in the cloth mask. But now they're telling us to wear N95, okay? N95s are used to protect us from smaller organisms like tuberculosis and other viruses. In this case, I don't understand why they're telling us to wear N95s when we're dealing with a droplet. So all this time, I thought that it was an airborne, okay? So when you deal with an airborne organism, you have to treat it differently, okay? So understand, right? So we're talking about the chain of infection. We talked about causative agent, right? The pathogen in this case, the reservoir, which could be a person, a human, or an inanimate object or a surface. The port of exit where it comes out through, your nose, any body orifice in your, or orifice opening in your body. And it travels how? By saliva, okay? In this case, it travels by saliva. There's other ones that travel by direct contact, right? Like if you have maybe bed bugs, or we call them scabies, or something that maybe a skin infection, you touch someone, right, directly, and you contract it, then that's considered contact, okay? Like I think last year, a couple of years ago, we had an Ebola breakout somewhere out there in Africa somewhere. Ebola is contracted through contact, which is completely different, okay? So I think it's a lot easier to control those kinds of infections, right? Because we can wear PPE. And you don't come into direct contact with people all the time, right? So mode of transmission, do they travel through direct contact, through saliva, right, or droplet, or are they suspended in the air, right? So when you have to deal with a virus that is suspended in the air, it gets very difficult, right, to manage it. So it's important that you understand how that bacteria travels. And as of right now, we believe that COVID-19, or the scientists tell us that COVID-19 travels through droplet, okay? All right, so it makes it into your body, okay, through one of your orifices, your eyes, your nose, your mouth, etc., okay? And it comes in contact with your mucous membranes. Mucous membranes are those that produce moisture, like your mouth, your nose, your eyes, your genitals, okay? Now, not everybody gets infected, okay? As you know, there's a lot of people, I think the majority of the people that came in contact with COVID-19 did not really have serious complications, right? Or serious illnesses. Most people develop maybe a headache, loss of taste, loss of smell, what else? Maybe, what was another symptom most people had? They didn't end up going to the hospital or even to the doctor. So anyhow, those people that got sick, for whatever reason, they were susceptible, okay? A susceptible host, okay, is the last thing that a bacteria or virus needs to be able to make somebody sick, okay? How do you know if you're susceptible? Who can tell me if you're a susceptible host? Who's a susceptible host here?
If you have a very weak immune system,
A very weak immune system. Very good. So what kind of people have weak immune systems?
people who already have problems like with diabetes and high blood pressure and this kind of diabetes and stuff.
That's correct. That's correct. That's what the medical people are telling us, right? People that have problems, medical problems like diabetes, high blood pressure, right? But there's also other demographics in healthcare that can contract a virus or a bacteria. It doesn't even have to be COVID-19. It could be anything, and they can die very easily. Those are the people that are getting maybe chemotherapy, or they have cancer. So their immune system is already compromised. So if they were to come in contact with someone with COVID-19, that would pretty much end their life, okay? What about older people? Older people are also susceptible, right, to infections. Why? Because as we get older, our immune system weakens, okay? We're not healthy and strong like we used to be, okay? So it's really important that you keep your immune system up to par. How do you care for your immune system? How do you keep it, in good shape?
Healthy habits, eating right,
Healthy habits. Give me
exercising,
good examples of healthy habits.
exercising, eating clean.
Exercising, yes. Staying mobile, eating a balanced diet, okay, maybe some vitamins, okay. So it's important that you keep track, not keep track, but just stay healthy, just watch what you eat and do some physical exercise, right, more than what you normally do. So again, as we get older, that immune system just drops. Now this is a funny thing or strange thing that we don't understand, is why kids are not as susceptible to infections, right? Now, new babies, younger kids that have very, very little immunity were susceptible. I think there were some children that died, but after they develop immunity, after they get their vaccines, they're pretty much immune to COVID-19. They don't get it, okay? I think the medical professionals still don't understand how this virus behaves, okay? So it's very difficult to pinpoint and say, okay, this is why it's making people sick, why it's killing people, older adults, and why it's not killing small kids. Okay, if anything, I thought kids were the ones to get it, but apparently that's not the case. So anyhow, you understand that there's these links, right, in the chain of infection that you must understand, and to be able to break the chain, okay, stop the spread of infection, we have to follow some practices, okay? So can you all see the whatchamacallit? The PowerPoint, right? The slide that I'm sharing right now?
Yes, it's on our end. It's on slide 89.
Oh, on your side? What's that slide? What are you looking at?
I'm looking at the PowerPoint on our portal.
Oh, on the portal. Okay. So
On
right.
the book is page 46.
Okay, but so nobody's looking at the PowerPoint that I'm sharing right now?
Yes, I can see it.
I can see it.
What do you see, Erica?
Es la rueda de causative agent reservoir.
Oh, okay. All right, very good. Is there something obstructing the view? Can you see it?
It was great. Okay, now we can see it.
Okay, cool. So again, this is a chain of infection, okay? So you understand what you need to be able, to have an infectious process, right? Or an endemic or a pandemic, okay? An endemic is like an infection that happens within a facility itself, but once it makes it out of that facility, then you have like a breakout, okay? And then you have pandemics. It gets worse, right? It goes all over the world. So, okay. Can you think of an example of each of the 6 links in the chain of infection? Okay, well, I'm not sure what. We just talked about the example of coronavirus. So even if one link in the chain of infection is broken, by simply washing your hands, okay, you can stop the spread of infection, okay? So washing your hands is the single most important way to prevent the spread of infection, okay? That's the only way that you can, that can contain it, okay? Many times, and I see it all the time, we fail to wash our hands, to use the sanitizers, to put on gloves, simple measures like that. We just, get lazy and we don't practice it, okay? And we don't hold each other accountable for that. Like there was a CNA in the facility that I worked that was seen, okay, by the state surveyors. They just randomly showed up, okay, and they go into the hallways and they see a CNA walking with gloves in the hallways. That's a big no-no, big no-no. state or no state, we should never use gloves in the hallways. Even if you're carrying a bag with dirty linen or so on, you cannot be wearing gloves in the hallways, regardless. No question about it. Okay. So of course the facility got cited for that, and that was a very dumb, mistake on her part. Okay. So when we see other people wearing gloves in the hallway, we need to tell them, hey, remember, we're not supposed to be wearing. And everybody knows, they just get lazy or careless. Really, they really just don't care, and that's not good. Okay, because everything goes downhill from there. All right. So who gives us all these rules and regulations about infection control? You heard the name, right? The CDC, the Center for Disease Control. These are the people that are out there studying other bacteria and viruses that are spreading or starting to grow, right? And they start to warn us about them, including the World Health Organization. It's another global agency that keeps us abreast of what's going on out there in the world as far as infections and endemics and pandemics. So they're also out there. Now, the CDC gave us something called the standard precautions, and I talked about them earlier. All it means is that you have to take your precautions, right, with every single patient or resident that you deal with, okay? Simple precautions like washing your hands and wearing your gloves, okay? That means that you're treating every person as possibly contagious. And that's all it means. That's what's standard. You apply them to everybody, okay? Now, at times, you're going to take extra precautions with other people, but those are different, okay? Anytime you're going to come in contact with body fluids, as we were talking about yesterday, right? When you're measuring the vital signs, when you're going to measure the oral temperature, right, or rectal temperature, things like that, any kind of body fluid like sputum, saliva, urine, feces, sputum, right, sputum or phlegm, you have to wear gloves, because if you don't, then you're going to run into problems, okay? You're going to have possibly or blood contact with body fluids and contract an infection. So that's why we always take our standard precautions, okay? One question, why should you take standard precautions with every resident? Why?
Well, because we move from one resident to another, so you don't wanna like transfer those bacteria or whatever, like to one room to another.
Okay,
Yeah,
but
sometimes they have different issues or they suffer from
okay,
different.
that's a good answer, but why do you have to take the measures? Yes, you're going to be working with one resident and another, right? But why is it that you have to take those standard precautions?
On the book, it says that we cannot see many of the illnesses around. So you don't see with your bare eyes whether
Exactly.
someone is sick or not.
Yeah. So we don't know, right? We don't know who has it and who doesn't. Okay. So there's examples. A very good example is a resident the other day was complaining of itching on their arms, right? Arms all over, just itching all over. And the CNA was like, okay, well, he has like hives, like an allergic reaction. That's what she thought, okay? But it turned out that this person might have scabies or bed bugs. Why? Because this person eats in bed all the time. So they're having crumbs and all this kind of stuff and germs in their bed. And yes, the linen gets changed, but this person does it every single day. So every single day you have bacteria, So every time you leave food or crumbs or anything, any little bug that's out there is going to eat it and, of course, start growing and causing infections. So that's why, the person or the nurse that was taking care of this resident, she better have been wearing gloves, because if not, those bed bugs will get on her skin and contract the infection as well. So you don't know when somebody has something. And all you can do is, again, is take your standard precautions. And it's all you can do, okay? So when you're taking measures, standard precautions, always wear your gloves, okay? And then wash your hands. Those are just the basic, okay? Again, we're gonna apply these to everybody. So good hand hygiene, of course, refers to washing your hands and using those antimicrobial foams or sanitizers as much as we need to. You only you can use a sanitizer as long as you want, okay? Unless your hands are visibly soiled, okay? Or if you feel like you just need to wash your hands, please do so, okay? One of the things, some of the mistakes that a lot of people have been making is when you wash your hands with sanitizer or you sanitize your hands, okay? A lot of people just get like, a little bit and that's it. You're actually supposed to wash your hands with sanitizer, just like if you're gonna wash them with water. So you're supposed to get a lot of that sanitizer, okay? Put enough to actually get your hands completely wet, and you're supposed to rub that sanitizer until it dries out, okay? If you look at people, they usually just get one little spray of foam and that's it. That's really not the way it's supposed to be used, okay? I think that's another thing that hasn't been really reinforced and pushed on. You have to get enough sanitizer to wash, get all your hands wet and wash your hands with it. Not just rub it, but wash your hands with the sanitizer. You wash your hands all the time, okay? Even now they're telling us, they're reminding us, putting up lists and flyers and posters, wash your hands, whenever come in contact with contaminated items like dirty linen, with a resident, before you go make contact with a resident, after you make contact with a resident, and before you eat, after you eat, and the list goes on and on. So just remember that you have to wash your hands pretty much continuously when you're in the job, okay? I'm not sure if you all have practiced washing your hands, but I do encourage you to go over the procedure, okay? Go over the procedure because it is a mandatory tested item, okay, for the exam, okay? So there's a couple of changes in there, and Ms. Reyes will be going over that with you. So next time she comes on, maybe we're gonna have her demonstrate it, okay? Because it is a little different. I was reading it yesterday. So it's not as long as it was before. It seems a little bit easier now, actually, okay? Now, you're gonna wear your gloves. You're gonna put on gloves, right, when you take standard precautions, okay? Gloves are part of your personal protective equipment, okay? So you're gonna don your gloves, when you're gonna put them on, okay? Usually, when you get the gloves, you're supposed to find the fingers, okay? Find the fingers on the glove, okay? And slide it in, same thing on the other one. But to take them off, okay, is sometimes the tricky part. You're gonna pinch one in the middle of the glove with the gloved hand, pinch in the middle, pull it off, okay? Roll it into a ball in here, and then here, skin to skin, your finger, you're gonna slide it under the glove and pull it over, okay? Right, without making contact with the outside of the glove, and then you're gonna dispose of the gloves, okay? So donning is putting on gloves, doffing is taking off your gloves. So it's really important that you remember how to do that, okay? You don't wanna grab the outside of the glove with your bare hand because it's considered contaminated, okay? So anytime that you're gonna be performing perineal care or come in contact with body fluid, even just going to the residence, okay? Many times they call you and they need some help, and you touch an area where they're laying around or they're sitting, you don't know where their hands have been, okay? Let me tell you right now. Sometimes their hands are not where they're supposed to be. And they've been touching the rails, the bed rails, they've been touching everything else. So please make sure you wear your gloves, okay? Now, they don't do this on purpose, but they're just laying there, sitting there, and many times it's not as safe or as healthy as you might think, all right? So just wear your gloves, okay? The other equipment that is now been talked about a lot is the gowns, okay? Gowns are another part of your PPE. Gowns are used only when you're gonna come and work, when you're going to work with a resident who has a contact isolation infection, all right? For example, like the one I just mentioned, the scabies one. If a person has an infection on their skin and you're going to be working with them directly, meaning you're gonna go and handle them and turn them and so on, your uniform is going to get contaminated, right? So you don't want to do that because then you're going to the next resident. So what do? Well, you're going to have to put on a gown, okay? In this case, we have disposable gowns, okay? And there is a specific way of putting it on, which you'll be working with Ms. Reyes as well, okay, learning how to put that on. Right now, it's really important, okay? And I don't think this thing is going away anytime soon. Flu season is coming up, so I'm pretty sure we're going to be getting more familiar with PPE and so on. Okay, so gloves, gowns. Okay, and now we're even having to wear a shield, right? Goggles or a shield is really important. Okay, and there's a specific order that you're going to learn how to put it on. Okay, so the book explains, right, the right way of putting on a gown. Okay, and then your gloves, and lastly your shield. So you're going to learn how to do that later with Ms. Reyes, because I believe it's still a tested item. I'll have to double check on that. There's some items that were added, right? So, and some items were taken out, but I'm pretty sure this one is still on there, okay? Because it's really important, especially now, okay? So, where am I? We're still here with PPE, right? So just keep that in mind, guys. There's standard precautions, and then there's other precautions that you also need to take, okay? These other precautions are called transmission-based precautions, right? It means that you're gonna take precautions depending on the method of transmission of the bacteria or the virus. Once again, we have the COVID-19 virus, okay? It's through droplet, okay? It's transmitted through droplet. So if somebody coughs, talks, sneezes, okay, you might require to be using a face shield, okay? Versus other residents that don't have that problem. You're not gonna be using a face shield with those residents. If they talk, cough, or sneeze, you might require to be use a gown, okay? And then your gloves, of course, right? So you always take your standard precautions, which is your gloves, okay, plus any other equipment that is necessary, right? In most residents, when they're on isolation, we post something on the door, a sign that is telling you, make sure that you wear your PPE. And there's pictures of goggles, gloves, and a gown. And we check that off, okay? We tell you what equipment you need to wear, okay? If you're not sure, you can always go ask at the nurse station and ask, what PPE should I be wearing for this person? So if somebody has COVID-19, obviously, you're gonna be wearing your gloves, your gown, and probably a face shield, okay? Now there's different kind of levels of COVID-19, the ones that were really sick, you know, the people that were in the hospital, the medical staff there were wearing like full gear, like probably very expensive gear to keep them from contracting the virus, okay? So again, follow the isolation precautions, okay, that are posted on the door, and if not, you ask what kind of equipment you should be wearing. Okay, does anyone have any questions on infection control, standard precautions, transmission precautions? One other precaution that you need to take are airborne precautions. Airborne precautions are for those that have an infection or a disease that is transmitted through the air, okay? Such as tuberculosis. It's one of the most common infections that happens in the elderly because at one point, maybe they contracted tuberculosis, and once they reach an older stage in life, their immune system decreases, and that bacteria is still in their body, and it kind of re-emerges, okay, making them ill. It was a big problem maybe about 20, 30 years ago. It's now very controlled, at least here in the United States, but in other countries where they don't screen their population for tuberculosis, it's a problem. It's still a problem in other countries. Now, that also crosses over to this country, okay? So when people immigrate to this country and they're not screened for this kind of infections, they bring it on with them and they pass it on to other people around them, and then the infection spreads, okay? So tuberculosis is considered an airborne bacteria because it's suspended in the air, okay? It's there, floating around in the air, okay? So have you ever seen a sunlight coming through a window, and through that sunlight, you see a lot of particles floating in the air, okay? So you see all this stuff floating in the air, okay? They're very small, okay? That's how small tuberculosis is, okay? It's floating in the air and it's just waiting for someone to come in and take it in, all right? Now, a young person may not necessarily get ill with tuberculosis because, again, your immune system is strong. However, okay, you can spread it to somebody else, right, that does not have a strong immune system, like an older person, okay? So that is why we get screened for tuberculosis, okay? Every year we have to get a screening. It's a little vaccine that goes here on your forearm, and you have to come back in 2 days, right? And then we read it and to see if you had a reaction to the medication, okay? So if your body develops a reaction, that means, number one, you're allergic to the medication, or two, you were exposed to tuberculosis at some point. There's a lot of people that come from Mexico, okay, like myself, that receive the TB vaccine, right? Because I think in Mexico and in other countries, they give you the TB vaccine. So if you got that vaccine, you're going to react positive, okay? So in that case, people that got that vaccine will require an X-ray, okay, to verify that they're not actively, or that the bacteria is not active in their body at the time, okay? So tuberculosis is an airborne disease, okay? It's not very common here in the United States, but it's still very common in other countries, okay? So for that reason, you have to wear your gloves, okay, your gown, and your N95, okay? Your N95 is a very important piece of equipment when dealing with airborne bacteria or viruses, okay? Now, another thing that most facilities have failed to do is that when they're issuing N95 masks, okay, in the hospital, when I used to work there, we get fitted with a mask every year, okay? Because you might gain some weight, you might lose some weight throughout the year, okay? If your face is small, they'll give you a small size mask, okay? They put a mask on you, and then they'll put this hood, right? It's like a plastic hood, and they spray this aerosol through a little hole, right? And if you can smell it, or you can taste it rather, if you could taste it, it means that there's air going in through the mask from the top, okay? Or through the bottom, or maybe the mask is too big for you, okay? So they give you a placebo. They'll spray one and they ask you to taste it, and then they spray another one, okay? So you don't know which one has which, right? It's kind of like a test, right? To see if you're actually telling the truth or not. Anyhow, you have to be fitted with a mask, okay? It's not one mask fits all. And I've seen people with large faces, the mask is just barely covering their nose and their mouth, okay? That's not a good size mask, okay? And that's one of the things that I think facilities have forgotten about, that we have to be measured, okay? Not everybody fits a medium-sized mask. What other bacteria are spread through the airborne? Well, we have, the shingles virus. Remember the varicella? Varicella is another one that's transmitted through the airborne. I always use this example because it happened in my house, okay? When I was a little, my brother got the, what do you call it? The varicella, right? La viruela, I think they call it in Spanish, right? And then my other brother got it. And then I got it, okay? So we were in the same house. They would tell us, please make sure that y'all don't play together, don't touch each other, and so on, okay? And we didn't. For the most part, we listened. But why did we get it? If we didn't play around or touch each other, how did we get it? Well, the thing is that back then, the people didn't understand that the virus, right, which is a virus, varicella, does not get transmitted through contact. It gets transmitted through airborne. Okay, so if my brother got it in the first stages where he contracted it, okay, he was coughing it, breathing, and the bacteria was going in the air, and all those of us that hadn't gotten it yet were contracting, right, la viruela, so, or varicella. So in essence, we ended up getting it anyways, right? So now, as we get older, okay, varicella can actually come out now. Uh, they call it the shingles, right? It's called herpes zoster, okay? But it's called the shingles. Most people know it as shingles. And the shingles can cause severe itching and pain around in some parts of your body, okay? Whether we have lymph nodes like under the breast, and the groin area, and the back, okay? Has anybody ever heard of uh, the infection called the culebria? Culebria? Anybody?
No.
Yes,
You've heard of the culebria?
yes. They say it hurts a lot.
Yeah, yeah, they say it hurts a lot, right? So why? Because that virus is in the roots of the nerves. Okay, so when you got it when you were a kid, the symptoms went away. Okay, by themselves, right? You were just left with all these little marks, right? Where you have those little blisters. Okay, so it's there and it came out, right? And the roots, remember your nerves are the ones that give a sensation. So if this virus is causing swelling in the nerves, you're gonna have a lot of pain and a lot of itching. How do you know that you're seeing shingles or culebria? Because they usually will come out like in little strains, like in little clusters, okay? And they follow like a little path, okay? Those paths, we call them lymph nodes, okay? And that's where they come out. They live in the lymph. The lymphatic system is also another part of your immune system, okay? So once they come out, a lot of people get them in the back, in the mid back, lower back, and it comes up to the center, around to the flank area, and they get a lot of pain. Some people get it under the breast, some people get it in the groin area, and some people even get it on the head, okay? They get it on the head, and that's where it becomes a little bit dangerous because shingles can affect your optical nerve, okay, and it can actually cause blindness. So the shingles it's also considered an airborne disease, okay, just like it started, okay. Hold on 1 second, my computer's about to die. Let me connect it before it dies. Okay, we have other, one more thing on contact precaution, okay? There's a lot of contact diseases and infections that are out there, but some are more common than others, okay? We wear gloves to prevent bacteria, viruses from coming onto our hands or to our body. So we wear gloves and we wear the gowns, okay? We wear gloves to protect ourselves from blood-borne pathogens. Those pathogens that are, we can only get through direct contact with blood, such as HIV, okay, such as hepatitis A, B, C, all right? So we have to take our precautions. Tuberculosis is airborne. There's other infections like MRSA. You might have heard MRSA at some point, methicillin-resistant aureus. It's another infection that is spread through direct contact. VRE, vancomycin-resistant enterococcus, is another bacteria that's spread through direct contact. Right, so it's important that you understand how these bacteria and viruses are spread so that you know what measures to take. All right, don't always believe what you hear or what somebody else tells you. Okay, do your own investigation and use PPE, as much PPE as you need to protect yourself. Okay. Okie dokie. Any questions? So we have, again, 3 types of precautions that we're going to be taking, okay? We call them isolation precautions or contact precautions. Number 1 is standard precautions, gloves and washing hands. Then you have your contact precautions, which is your gloves and your gown. And then you have airborne precautions, which requires your gloves, your gown, and a face shield, all right? Normally a face shield, okay? Right now we're wearing a mask too. I'm sorry, you do need a surgical mask, okay? For droplet. And then for airborne, you need your N95, okay? your N95, your gloves, and your gown, okay? At this point, we're taking extra precautions because of the severity of COVID-19. So we're wearing all the gear, okay, for the residents that have tested positive and they're quarantined. They tested positive for COVID-19. One more. C. diff. C. diff is called Clostridium difficile. It's a bacteria that lives in our gut. Everybody has it. Okay, you have it. I have it. Everybody. It's in your small intestine. Okay. C. diff is a bacteria that can cause a lot of problems for some people, especially if they take antibiotics. If you go to Reynosa or Progreso or somewhere and you take antibiotics because you got, you're sneezing and coughing, well, you're causing an imbalance in your intestinal flora, right? In the bacteria that live in your intestine. So by taking antibiotics, you're wiping out your good bacteria, and your bad bacteria, such as C. diff, is causing an imbalance, okay? You're causing an imbalance and you end up with diarrhea. So older people, as you know, they are in and out of the hospital. They're always getting antibiotics for everything, right? So next thing you know, they have this constant diarrhea, okay? The difference with this diarrhea is that it smells really strong. It's really acidic, okay? So when you smell it, it almost burns your nostrils, okay? So that's when you know you are dealing with C. diff, okay? Who can tell me what precautions you need to take with C. diff if it gives you diarrhea?
What was your question? Sorry.
What precautions do you need to take if a person has C. diff?
All of them. The gown, the gloves, I mean, it's not airborne, but if you're gonna get in contact with fluids, or you might be getting in contact with fluids, especially if you're gonna change the resident of the area, then your gown and your gloves, and well, right now it's regulatory to wear a mask for COVID-19, so a mask, and and the and even though it might not be, but diarrhea can be very watery, so it can splash your face. So I mean, it's a good idea. It's a good idea to wear a face shield too. Why not?
Yeah. Well, it would be a good idea, but it's not necessary. But yeah, you're right. We call those contact precautions, right? If it's really watery, I don't know, like swimming in the diarrhea, it would splash. I've never seen that, but it could happen. But contact precautions is usually what you need, right? Your gloves, your gown, okay? If you're gonna have someone, um, a mask is not necessary, okay? A facial is not necessary. And like you said, right now we are using it, well, because of COVID-19, but other than that, it's not necessary. Okay, what if somebody contracts tuberculosis? What kind of precautions do you take?
Since it's airborne, then the N95 and the face shield.
Respirator?
N95 is correct. What else?
A respirator mask?
Well, people call them a respirator, and I've seen people with all these, like the valves, the exhalation valve, okay? When you breathe in, and the air that you breathe out comes out through the valve, right? Um, N95s, again, are the mask, the ideal mask, okay? And in the hospitals, they don't really use the exhalation valves, but that's what you need. So you need your N95 mask, okay? Your gloves, of course, okay? And this, and a gown, possibly, but most likely you don't need a gown. But right now, everybody's using gowns for everything. The last one, MRSA. What is MRSA? Did I talk about MRSA? MRSA is another infection. It's a skin infection. You've probably heard about it in the news, right? People can get very sick for MRSA because it's a resistant bacteria. Okay, you can't kill it with normal antibiotics. It takes a long time to kill MRSA. Okay, and it can come back, especially for those that are diabetic or have other medical problems. MRSA can be a big problem to get rid of. Okay, so MRSA requires contact precautions. Okay, your gloves and your gown, right? So MRSA, again, is a very common one. VRE is a common one. TB is a common one. The shingles, right, or varicella, or we call it herpes zoster, is a very common one. So it's important that you get familiarize yourself with these different bacterias. And there's a bunch more, but those are the most common ones that you're going to see in long-term care because that's what we're dealing with, okay? Hepatitis B, I know I didn't talk much about it, but hepatitis B is a bacteria that infects your liver, okay? It's more like a virus. A virus affects your liver, and you can get it from people that are infected with hepatitis B through direct contact, sexual contact, all right? And there is a vaccine, okay? There is a vaccine that your employer should provide you with, okay? If you choose to take it, a vaccine to prevent hepatitis. So I encourage you to take the vaccine. If you are already over maybe 20 years old, if you're over 20, your body has probably forgotten your immunity to hepatitis B. So it's important that you accept it, okay? Don't waive it. A lot of times these employers will tell you, well, if you don't want it, you don't have to take it, right? But in reality, it's better if you do take it because if you get contracted, then your liver is going to suffer and can cause liver cirrhosis, which is death of your liver, right? And we cannot live without our liver. So it's important that you take the vaccine. It's not gonna hurt you, all right? It's gonna hurt you if you don't take it. So that's another virus that is out there, but that's only through direct blood contact, which is rare, okay? Unless you're working directly with blood, like phlebotomist, for sure you need to take it, okay? Okay, take a little break here. We're done with chapter 2, okay? All the exams should be open for chapter 7 and 2, unless I forgot. Did everybody get to do chapter 7?
Yes, yes, I finished it yesterday.
Okay, very good. So I'm gonna
Thank
open chapter 2 then. So y'all can take the exams after class. All right, so let's take a 10-minute break, okay? We'll be right back.